We need one because at this point, Black women are dying 3 to 4 times the rate of white women in pregnancy-related deaths and complications. And actually, depending on where you are in the country, it might be as high as 8 or even 12 times the rate of white women. We have had this problem for a very long time. And as a matter of fact, out of all the developed countries in the world, the US has only, maternal mortality has increased versus all the other 20 that have gone down. We also spend a ton of money on healthcare. And so why aren't we seeing better outcomes, and better outcomes, especially for the disparities with Black women? And so the hope and the dream with, having a Black Maternal Health Week is that we can get some more focus and start to address this problem from all the different ways, right? Because it's bigger than trying to just fix maybe one clinical person. We need to fix clinical systems, maternity care systems. We need to work on policies for families. We need to also, as a community, as a society, really value maternity care a lot differently than we do now. The CDC just started to now acknowledge racism's effect on maternal mortality. Now we're having the bigger, broader conversation of what racism's effects, and racism is huge, right? It's about power. It's about time. It's about systems. It's about interpersonal interactions. It's wide and broad. And so I think that we're starting to understand that while we can talk about maybe social economic differences, can we talk about redlining? Can we talk about food deserts? When we want to talk about more so, for example, vascular diseases like hypertension and diabetes, and why you see more of a prevalence in this Black community. It's not race, it's racism. We're talking about more now the effects of chronic stress and what that does on the vascular system. And there's already documented research looking at how one stressed individual stresses out the next 4 generations. And I don't need to do that math for you. And so now we are finally having the harder, broader discussions of this very touchy topic. And, for me, I'm not scared anymore. I'm not scared anymore to talk about it because it needs to be talked about, because it affects everything.